Do you understand ObamaCare and how it might affect you? Do you know if you're eligible and what it entitles you to? Or are you completely confused and frustrated by it? Well, this hour, I'll ask the questions you want answered as we explain ObamaCare right now on It's Your Call. ObamaCare is in the headlines every day. It's touted as the crowning achievement of the Barack Obama administration. It's linked into negotiations about the federal debt ceiling, and it's supposed to be the answer for millions of uninsured Americans. But do you really understand it? Well, if not, you're not alone. So this hour on It's Your Call, we're going to do our best to explain it to you in plain and simple English. Hi there, everyone. It's great to have you with us for this ObamaCare tutorial of sorts. I'm Lynn Doyle. From what I can tell from talking with you and from social media sites, this whole ObamaCare thing has many of you stumped. So we've invited two experts in ObamaCare, also known as the Affordable Care Act, to join us and to answer as many questions as we can get in the next half hour. You know our guest well. Joel Neroff is the president and founder of Neroff Economic Advisors, which is a strategic economic consulting firm. He's a nationally recognized economic forecasting expert. He advises companies across the country on the risks and opportunities that economic developments may have on their organization's operating environment. Terry Rivera is the vice president for mission and community health at St. Mary Medical Center in Langhorne, Pennsylvania. Her role there is to educate people about the health insurance exchanges and enroll people in them. She's going to help us out today. Thank you both so much for joining us.
Thank you.
Thanks for having me, Lynn.
So you both kind of chuckled when I said this was a tutorial, but I really find that that's what we need, because people go, ObamaCare, yeah, I heard about it. I have no clue how it affects me. So we're going to try, in the simplest of terms, Joel, to explain to them what the mission, what the intent of ObamaCare is.
Okay, well, I think the basics that you've got to think about and remember is that the way we deliver healthcare and healthcare insurance in this economy is most of the people who have insurance either get it through the government, basically through Medicare or to some extent through Medicaid, or through their private employer.
Okay.
Your private employer provides the insurance. If you don't get it in either place, you're essentially without insurance unless you can manage to purchase it individually, which is extraordinarily expensive.
Okay, so we have to explain the vocabulary. Yeah. So you have the insured who either get it through the government or through a private employer, or you have the uninsured.
That's exactly right. And if you're uninsured, that doesn't mean you don't take advantage of the healthcare system. It's just that who pays for it then is somewhat different. Either you pay for it to an extent, or your costs, which you can cover, has to get spread through a variety of different insurers, the providers, the hospitals, and even the people who have insurance. So that's the problem we have with the economy and the insurance system.
So ObamaCare, the Affordable Health Care Act, is intended to help those people who fall in the uninsured category.
That's right. Those people who can't get the insurance in one of the ways we've described, they now have the opportunity to apply and become part of the insured, which will expand their access to the healthcare system.
So who pays for it then if they get to apply for it and they're not getting it from the government and they're not getting it from an employer?
Well, if they become part of ObamaCare, then they pay part of it, but the government is also, to some extent, subsidizing their costs.
And hence the controversy.
That's exactly right. And that's why it's become so complicated, because while there are subsidies, the government has to pay for it, because some people didn't want to put this in place unless somebody paid for those costs.
And that somebody, when you say it's the government, essentially is us,
it's
the
us,
taxpayer.
It's the taxpayers.
So again, hence the controversy. People who are opposed to Obamacare don't want it because they don't want the government or the taxpayers to have to provide one more thing to American citizens.
Well, I think there's a variety of different reasons why people don't want it. Some of them just don't want the government involved in the healthcare system. Some of them don't want the government to be paying more than they are, even though the largest healthcare provider in the country is the government through Medicare. So, what we have is a variety of different views on the role of the government in the healthcare system here.
Regardless of whether you support it or not, it's in effect. It took effect in October of 2013. So who is then eligible for it? How do we know, Terry, if this applies to us or not?
Well, as Joel said, the uninsured and probably those who are buying insurance on the health exchange have the opportunity, but there are some stipulations. You must be a citizen or a national. You can be a non-citizen who's here lawfully, but you have to be present in the United States for the time that you will be insured. So those are the folks that can go on to what people call the healthcare marketplace, or another word for that is the exchanges. And the exchanges are actually web-based, most of them. So folks can go on to the internet and they can have access to healthcare through healthcare.gov.
Okay, which is a problem unto itself.
Yes, we have some stories about that. Yes.
We'll get to that later on in the show, but right now we want, again, with the vocabulary lesson that goes with our tutorial, the exchanges are essentially the marketplace.
Yes.
And the consumer has an opportunity to shop for the kinds of healthcare benefits they want the government to provide.
Yes, there are many plans. Well, there's two marketplaces, and I think this is causing confusion as well. The states have the opportunity to create their own marketplace, or if the states chose not to, then the federal government came in and had a federal marketplace. They both work essentially the same, and in both marketplaces, the insurance companies can apply and say, I'd like to provide services for you to buy health insurance.
All right, well, I'm confused, because why would both the state and the federal government need to provide these exchanges?
Basically, it was part of the political battles and ultimately the Supreme Court decision that upheld the Affordable Care Act, but also allowed the states to opt in or opt out. And so what you have is this situation, it's a dual situation. And whether they're in or out, to some extent, it's a political battle that's going on. Some of it is an evaluation of which is the best way to go. But unfortunately, it's created a dual system, which was really never the intent. But that's what we have. That's the way Washington works.
Is there one thing going on out there right now that doesn't have a political edge to it? Now our healthcare has a political edge to it, and people, I'm sure, are confused. If you have questions or comments, or you want to weigh in on this, you can email me at lynn@lynndoyle.net. You can also send us your questions for our experts, and they can reply to you later if we don't get you on through the air. But we do have some people that we're going to check in with as the show goes through. So go ahead and email us if you have questions or concerns about explaining Obamacare. So let's use Pennsylvania, for example. Okay. As a means of getting our insurance. Let's say Pennsylvania has exchanges, it has a marketplace. I'm a consumer, I go on, I say I want it to be monitored through the state. What's my process? How do I do it? I choose the state exchange as opposed to the federal exchange.
Well, you don't get that choice because Pennsylvania decided not to have a state exchange.
Oh, okay.
So they can only opt into the federal exchange.
Okay, that's good. So that's one question. How about New Jersey or Delaware or New York? I mean, you pretty much go on and find out whether your state individually has opted to do it.
Yes.
Okay, so once you've determined whether you're going through the state exchange or through the federal exchange, how does a person apply? How do they go about doing it? What do they have to provide to the website?
Okay, they go on to healthcare.gov. And some of the things that you should bring with you are your Social Security number and those in your family if you have children. And you need to estimate your 2014 income. That's one of the things that the exchanges will be asking. You will go on and you'll establish what's called a home page. You'll have a password. It'll just be your home page. You will then proceed through the application process. And I'm assuming we'll talk later about the help that's available. You'll pick a plan and then you will enroll. So that is, in a very short nutshell, a very short time, what's happening on healthcare.gov.
Now I'm curious because you talk about picking a plan. So the consumer actually has options even though it's the government that will be providing them for the consumer?
Right. There are a number of different plans that are available, and their costs obviously vary by the quality. And the consumer will go on, they'll take a look at the options that are there, and you can pick the one that you feel is most suitable to yours. and you'll find out the cost that's involved with that. And the interesting thing about it is the costs will vary. If you're in Pennsylvania, it'll be one cost for a silver or platinum plan. In New York or New Jersey or Texas, it'll be a completely different price. The insurance companies are on there. They're trying to bid for the customers. So things will differ across all the states here. Regardless, you'll see what your costs are, you'll see what the plans are made up of, and you can make your choice on which one to opt into.
So when the consumer is making that choice, obviously I'm a consumer, I'd like to have, the platinum plan. I mean, I want the best health care I can possibly get. But since I'm not paying for it, then I have to weigh the options that are provided.
Well,
I want to make a good consumer decision. How do I do that?
you are paying for it. But depending on your income, you will get assistance from the government in paying for it. So just as you and I purchase health insurance, you're going to purchase a premium and you're going to make monthly payments to that insurance company. Most of the folks will have some kind of subsidy depending on your income, but you actually are going to pay every month for that health care insurance.
So I hate to play devil's advocate here, but that's what I get paid to do. What would motivate anyone then to go on and sign up? Because if I'm uninsured now, it's because I don't have any money to pay for it. I'm not going to suddenly find money because I went to healthcare.gov. And if I have an injury or a reason to be in the hospital, the government ends up paying for it anyway if I'm indigent or unable to pay. So what's the benefit of having it?
Well, go ahead.
See, they're tossing it to each other.
There's a very
There's a
big
clear-
benefit.
it's clear.
Because these healthcare plans are offering what are required to offer essential benefits. And it's not just to cover you when you're injured, Lynn. It's to cover you in preventative care. It's to cover you when you're pregnant. It's to cover you when you need outpatient services, when you need rehab. It covers behavioral health and substance abuse treatments. So there's many, many essential benefits that every single plan on the exchanges, whether they're state or federal, have to comply with. They're called the 10 essential benefits.
Okay, and we're showing them right now. We have to take a quick
Right.
break, but we want to invite our viewers to be part of our conversation. So if you have questions about Obamacare, if you're considering it, or you've registered, you've tried to register and you've had trouble, we'd like to hear from you. We'd like to share your experience. Or if you're completely overwhelmed by all of this and you have questions, we'd like to help you out there as well. You can email me directly right now. I'm at lynn@lynndoyle.net. As always, you can find us on Facebook and you can follow us on Twitter. Of course, St. Mary will help you as well. You can always go there. Okay, we're going to take a short break. We'll be right back. Since it took effect October 1st, 2013, Obamacare has simultaneously helped, confused, frustrated, and assisted millions of Americans and raised almost as many questions from healthcare consumers. So on this edition of It's Your Call, we're trying to answer some of the most common and pressing questions that you might have. We welcome you back. I'm Lynn Doyle, joined this hour by Joel Neroff, who is the president and founder of Neroff Economic Advisors, and Terry Rivera, who is the vice president for Mission and Community Health at St. Mary Medical Center in Langhorne, Pennsylvania. My favorite hospital, just have to say. They are tackling some of the most common concerns that we have, so we're going to get to those in just a moment. But first, we want to return to the conversation that we were having right before the break, was asking about healthcare consumers like yourselves and how they know if they're eligible. We gave you that. We gave you some of the benefits to signing up, that you have preventive care and that kind of thing. Is there like a sliding scale, Joel, that if you make X amount of dollars, you get X amount covered? And how can we explain that to people? Like, give them an example of how much money they'd make and what they'd get.
That's exactly the key point about the coverage, is that you go in and, like Terry said, you have to estimate what your income's going to be. If you're basically getting minimal income, let's say less than about 11,000 or so, you're going to get most of your premiums covered for the basic coverage by this subsidy that the federal government's going to give you.
Now, when we say that you get it covered, does it come to you in the form of a check? Does it, when you're on the website, do you just check this off, or do you actually have to write a check or give money and then it comes back to you somewhere down the line?
Well, this is a private insurance and you have to pay your premiums, but you can opt to have the government send some of the assistance they're giving you to pay for this health insurance directly to the insurance company.
Okay, so people don't necessarily have to
yes,
put it right out of
yes.
their pocket.
Yeah, and if they're getting less of a subsidy because they're making more money, you can take a tax credit at the end of the year.
Okay, and it is a sliding scale. So if you
Yes.
make $11,000, you might get most of it
Yes,
paid for. What's the top of the scale so that people know, okay, I make $50,000, I'm not in? I mean, what is the number? Do you
For
know?
individuals, it's $45,960.
Okay, so I was close with the 50. So that's for individuals, and it's broken also down for families?
Yes,
Or?
a family of 4, $23,500 is the starting point, and $94,200 is the ending point.
Okay, a family of 4.
Yes.
All right, so that's going to lead me into our first question from Facebook. You guys ready for this? The questions are tumbling in, and they're thinking, oh my goodness, what do they ask? Okay, this one says, quote, I am not yet divorced, but will soon lose my husband's benefits. Is this something I should consider? I make about $50,000 as a freelancer. This comes from Jay, but she says she has 2 kids. The kids are covered under her husband's benefits. So is this something for her?
I think it is. I think this gives her an opportunity to go on to the exchanges and look at several different options. Even if you don't get subsidized, you can go on, and it's probably going to be a lot cheaper than buying her insurance as an individual.
And I think what people need to really, recognize, and what the viewer needs to recognize, is that she's probably going to needing health care coverage of some kind. She's going to be going into the system in some way or another. And by having the insurance, when things come up, she's going to be willing to get them taken care of.
Right.
And that's really critical. You don't want to say, gee, I'm not covered. I don't want to have to pay the $250 or $300 out of pocket to go see the doctor. And therefore you put it off. That creates even more problems. So having the insurance and paying those fees really does help for her long-term health, and that's part of the critical aspects.
And
here.
I hope that you get that message out to
Yeah.
people, because Terry and I knew each other because we worked on the 3-day breast cancer walk through Susan G. Komen. As people know, I've done that for many years. We often found that women ended up finding out that they had breast cancer and they hadn't gone for their mammograms or doctor's visits because they didn't want to have to pay for it. They were uninsured, they didn't have it. If that had been done, they might have caught it earlier and not had the expense and the emotional and physical damage that was done to them. So that's a perfect example, isn't
It's
it?
a wonderful example. Preventative care, can really affect the entire health of this country. I am so excited about the Affordable Care Act because it does put a spotlight on preventative care. Women getting their mammograms, men getting their prostate exams, simple things like colonoscopies after age 50. Colon cancer is so treatable unless you catch it really late. So this is exciting for us in the healthcare field.
Boy, I'm glad to see someone's excited about this.
And as an economist, that's why this whole debate sometimes in Washington drives me a little crazy. What's the value of the preventative care that comes out of the ACA? Nobody looks at that. It's tough to really measure, but it's clear that there's a tremendous value to society of that. We only look at what the government's going to pay, not the benefits on the other side that aren't directly measurable. And here's a situation where it really has tremendous value.
Okay, people, I hope you're listening, because there is tremendous value here. It can save your life if you get this insurance and you take advantage of some of the preventative measures. You could live a long and happy life. Let's go to our next question. Can you sign up for this if you have a pre-existing condition like diabetes? That comes from Harold.
I'd love to
Again, she's
answer
so
this.
happy.
That is one of the most exciting things about the Affordable Care Act, is that the insurance companies can no longer deny a person coverage because of a pre-existing condition. It's phenomenal. It's going to change the lives of so many people in this country.
Oh, that's great news. Okay, and here's our last question for this block. How long can you stay on it? What if you get a job that has health insurance? Do you have to leave it, or can you have both? That comes from Mary Lou.
Well, you generally have an option. I mean, you can go one way or another. You're going to look at the costs. And if this is a better program at a lower cost, you may want to stay with it. It also depends on your income because there are income limitations that are involved. So there are issues that you have to make decisions on, but this gives you options. And
Hey,
that's
listen,
important.
if you get a job and they're giving you health insurance, I would say that's cause for celebration. I have to take a break, but if you have questions or comments, go ahead and email them during the break. It's lynn@lynndoyle.net or look for us on Facebook. We're going to answer some more of your concerns right after this. Welcome back to It's Your Call, where we are trying to explain Obamacare. Hopefully we're doing a good job for you. If you have questions or comments, email them to me at lynn@lynndoyle.net. We want to get right back into some of these questions because we don't have a whole lot of time left. This one says, if there are concessions made or if Obamacare is repealed entirely, what happens to the people who have already enrolled? What can you say to Craig?
I'm not sure exactly what that would entail. I don't think anybody's gone down that route right now. So I guess I'm pleading ignorance.
Okay.
Terry, does anybody know at this point?
I don't think so, because people have purchased insurance. I mean, they're well on their way.
Right.
Yeah.
I don't know what would happen.
Do you know what this one means? Do we have to pay the penalty if, quote, we're unable to pay our utility bills? Stephen's asking.
Well, there's a hardship clause in the exchange process. So if you are very low income and you still aren't able to purchase the insurance, say your state hasn't accepted the Medicaid expansion, there's a hardship waiver. You can go on and apply, and probably you will not have to pay the fine.
Okay, and this one says, I've gotten what appears to be inaccurate information from the government website. My agent has given me different information. No one, and I mean no one, knows what's going on. One thing is appearing clear, though. This act will affect everyone and not necessarily in a positive way. That comes from Jill. Have you found that people are getting frustrated and either not taking advantage of it or just walking away or waiting?
It's really, really very early on in the process. The website's not working well, to say the least. It's not working, at all. I think things are going to shake out. It may take longer than anybody had expected. And no government policy, no policy of any kind is going to help everybody, but this is going to help most people. Okay,
one very quick question before we are out of time, and that is, when does it take effect? If you go on and the website's working, you go to the exchange, you make a selection, at what point will you then be insured? Do you know?
Yes, we do. If you apply and are enrolled by December 15th, your insurance will begin January 1st of 2014. And don't panic. We still have a lot of time. We actually had our first person at one of our enrollment centers able to get through almost all the process. She's now picking her plan, but it's starting now to pick up.
Okay. And finally, senior citizens, do they need to look at this, or are they already covered on Medicaid?
If they're eligible for Medicare, don't worry about it. Their Medicare is going to take care of things.
Okay. So what is the message that we'd like to leave in the minds of our viewers as we conclude our tutorial here?
This has tremendous amount of opportunity for a lot of people. There's glitches, as always the case, but once it shakes out, people who haven't the insurance, people who haven't had access to the healthcare system are going to get it, and that's great.
And for a facility like St. Mary, is this something that will then be able to offer more healthcare to more people?
Yes, and especially those who haven't had health care and those who are poor and really struggling in our community. To us, it's a wonderful opportunity, and we're going to reach out to them, find them, help them, and hopefully they'll be insured.
All right. Well, thank you both so much for your
you.
insight and all the helpful information. If you were unable to get through and you still have questions, email us at lynn@lynndoyle.net. If you have specific questions for either Terry or Joel, we will make sure that they get them. Thanks so much for watching. Good luck. See you next time.